So we have our fantastic patient today. I have really been waiting all week to do her case, okay? So last week, we had several patients that we had recorded, and many of these patients were revision surgery. So they'd had procedures before, all this kinds of stuff. So when she came in and said, I've never had anything, you have no idea, like my blood pressure went from here all the way down to here, and I've been excited about this case ever since. So her main goals that she doesn't like is this little indentation right here, the lack of definition right here, and she does not, can I have you sit up for me right here? And the lack of definition that in the neck right here, okay? So one of the things that I really want to point out, so what we're actually going to be doing on this patient is we're going to be doing a deep plane facelift to address all of those issues. So if you take a look, and actually I'm going to lift her tissues to where it's supposed to be, look what happens to her face. This is where this fat pad used to be and needed to be up there. It sharpens the jawline. It makes her cheeks look more full, okay? It just kind of creates that heart-shaped face again. So as we age, all the volume was up here, it starts coming down, you get more of a round face, okay? And we want to recreate that nice definition. Same thing here in the neck. Here, we've got this little bit of loose skin, but underneath this, I know for a fact we're going to have some loose, lax muscle, and there's going to be a little bit of fat in there. So what we're going to do is really tighten that in there so to give her that nice, plain angulation to her neck. So she's a little nervous this morning, which is normal for our patients, okay? However, we're about to give her medications and get started very shortly. So I'm really excited. So I'm going to let you have your medications. Do you have anything that you want to say to the world out there?
Just waiting for my wonderful result.
So we're here with our patient. We just finished surgery on her yesterday. We shot the video before surgery. This is 1 day post-op. I mean, look at that smile, okay? That is what I want, okay? Look at this jawline. This is the jawline. I'm gonna turn her head a little bit this way. Look at that neckline. All I've done thus far is I've taken out the drains and I've taken out some of the sutures here, and this is her literally less than, we finished at about 4 o'clock yesterday, so 12 hours, a little bit more than 16 hours after surgery. So when surgery, again, as I was trying to explain in one of our other videos, things that are awesome. She is healthy, healthy, healthy. She's followed every instruction. She's not had surgery before. Planes are simple. They are clean. They're neat. Okay, and this is the kind of results you're gonna get. And if you wanna know why I work, okay, what my whole rationale for working is, you see that smile right there? That, like, you guys didn't get to see it, but what happened is when I first showed her face and she has that, this is why we work, okay? So, and you can also see right here, we've kind of done a little bit of fat grafting in this area and this area right in here, just to accentuate her cheek. Okay, she's also had a little bit of fat grafting right in her lips right there. And she has a little bit of fat grafting in her nose just to give her a little bit of the lift that she wanted. Okay?
Fantastic.
So, see that smile?
I love it.
Remember that smile?
100% recommend. Dr. Athré, come and see again. Pero parece que no pasó, niña. Ah, no, sí. Pero te va a quedar bien definida, sí, súper, súper. Nada ya de papada. Una niña yo quiero, pero me da miedo. Sí, no, yo creo que mi hija tiene más Sí, te quedó súper. No. Y ya cuando se quite, o sea, los moretones o cosas así, no. Olvídate, wow. Muy padre. There, yeah.
Okay, so here's our wonderful patient. We've now seen her before surgery, day of surgery, day after surgery, okay? And one of the things I want everyone to know because it's this important to me. I prepped her and I told her that she is going to look like an alien on day 3 after surgery. No matter how good you look day 1, day 3, day 4, you end up looking like an alien. Am I right?
Yes.
Yeah. And if I hadn't warned you, you would have freaked out.
Yes.
Okay. So everything tends to swell. So swelling in the body normally occurs at about 3 to 4 days after surgery. That's kind of the normal process of body healing. So you can see day 1 after surgery, when we took the dressings off, you saw a lot of increased definition. Then what happens is everything swells up. Okay. And then what she's going to be doing is kind of massaging everything. She's done a fantastic job keeping everything clean. We'll have some photographs that we'll show of the actual incision lines. Actually, I'm going to turn you over that I can show right here. You can see how she's kept everything so neat and clean. The incisions look fantastic. Okay. This is all her hard work. Now, this swelling, probably in about another 3 or 4 days, is going to start coming down to the point where she'll start looking more humanoid, and it'll continue progressing from there. How's your experience been so far? A lot of pain? Tell people, what does it feel like?
No, I didn't feel pain. The only pain I feel was the first day, and I took a pill, and then everything else is Tylenol. Okay. And then not even the nausea or anything like that. Eating normal, nothing. Okay. Just to feel tight.
Yeah.
Uncomfortable, but it's a process.
Right. But you can see, like, smiling, she drove herself here.
Oh, yeah.
So she's been walking around doing her normal activities. So
yes.
This is kind of what I expect of my patients. So it's a lot of surgery. It's a lot of hard work. But as long as everything is done, kind of according to plan, you're going to get results like this where people are able to get back to doing normal activities sooner. So we will follow her out on her journey, on her makeover journey, okay? And you'll see. I'll see her probably next week. And when I see her next week, you're going to see a whole different person. Then we'll see her back in about a couple weeks after that, and it'll get even better at that point. So it's just, it's like fine wine. It's just starting to age. All right? So I have my patient here, and you have probably seen her on multiple videos. We started something called photojournaling, and it's part of Project Athré. And you've seen her before surgery. We saw her 1 day post-op, so on. So we're seeing this kind of gradual transition. And so I saw her today. So here she is 2 weeks after a full facial rejuvenation. So we did deep plane neck lift, platysmoplasty, and some fat transfer on her, okay? And I can't believe it myself. So that's her before. You can see what she looks like. We actually posted one of her pictures on our Instagram before, and one of our patients actually said she looks like a teenager. And so you can even see her side profile. And one of the really cool things that we've done in her, it's not just this overall result. And I keep talking about this idea, and it's that the whole is greater than the sum of the parts. When a patient comes in and we come up with a game plan, like we came down, we wrote down, this is what I want to do, this is what I want to do. There's parts of this that are adapted in the operating room. So one of the things that she told me that she really wanted was she wanted to kind of have a little bit of a cutesy nose. So I told her, hey, we're going to put some fat in there. Okay, it's something I've done before, but I know for a fact that that is something that a lot of patients can't tolerate. It is something that is quite painful. I think that many people have said that. And I said, listen, I'm going to check and see how you are during the surgery. And if you're doing well, we can do that. And I mean, she has the cutest little nose. We haven't done any surgery on her. We just added a little bit of fat, which allowed lifting of the tissues a little bit. And it just fits her. So here you are. There you go. So there you are. You finished this whole thing. And I'm sure the first time I told you we're going to do this with you awake, you were a little nervous.
Mm-hmm.
Okay.
I was.
She actually told me that she had a conference with some of her colleagues at work, and they couldn't believe her age. They guessed in her 20s. So I'm not even going to tell them your age. If you want to tell them, you can tell them. So
I'm 48.
She's 48, okay? So, I mean, I think she looks like a rock star. How was your process?
It was really easy. Everything was amazing since I came over here the first day. I was a little nervous. I didn't feel any pain. The day after, I just took like a couple of pills for the pain, and everything else was Tylenol. Everything went wonderful. Healing, everything, it's perfect. I love it. I love my results. I love it. Thank you.
It's my pleasure. And I want everybody to know this is 2 weeks out, okay? This is not the final result. She's going to get even better. I mean, there's still a few lumps and bumps and bruises and swelling and all that kind of stuff. This is going to get even better. So I'm beyond stoked to see the final result. This is, as I've said on, I think actually on her prior video, that smile is what makes me come to work every morning. Like, I see the names on the list of appointments and I'm like, I can't wait to see that person. I can't wait to see that person. So this is what inspires me. So I hope these videos help people in terms of understanding what it is that we do, how we do it. If you have questions, always give our office a call. We've got everybody here who's more than happy to listen. Ciao.
Bye.